Welcome back to the show. Today is Bell Let's Talk Day, and we wouldn't be able to really talk about how we're doing without the proper language to both explain how we feel and to be able to support the people around us.
Here to help us better understand the role that language plays when it comes to our mental health and is psychiatrist and chief medical officer of the 988 Suicide Crisis Helpline, Dr. Allison Crawford. Thanks for being here.
Thank you so much for being here. Thank you again for being here. Words matter, and I know in life the type of language that we use matters. So what do you want to remind people to be conscientious of when it comes to talking about mental health specifically?
Well, first of all, it's Bell Let's Talk Day, and I think the good thing is to talk about it, to approach people you know, to have conversations. But the language that we use has changed a lot over time in some really important and good ways. So we know that, some ideas about mental health can be stigmatizing. So talking about mental health as if someone is weak or might be violent. And also stigma is when we have negative ideas about things, and that idea sticks to people. So when we use words like nuts or cuckoo or crazy, it makes people feel like they're outside of the social, that they're not acceptable, and that's actually a risk for mental health.
Okay, so we're going to go through some scenarios where we can see that language has a huge impact. But before we do that, we're going to show a Kids Help Phone ad that really highlights our first scenario. So why don't we first take a look at that?
I'm fine. I'm fine.
I'm fine.
I'm fine. I'm fine. I'm fine. I'm fine. You okay?
I'm fine.
I think a lot of us can relate to that, where you're talking to somebody, a young person, anyone, saying, how are you? And they say, I'm fine, and they're not fine. So what should we be saying to try to elicit more of a response, if possible?
Yes, I mean, that's a very powerful video because we've all done that and experienced that. And I think I'm thinking of the mom touching the shoulder of the son. It's obvious she cares, but she's also turning away and walking away. So I think sometimes when we're asked, we don't know that the invitation is to open up. We're so used to socially saying, I'm fine. So if you really want to hear how someone is, to actually make eye contact, create that space for a conversation, sit down, and also don't be put off if someone says, I'm fine. Say, wow, don't be afraid to say, I'm concerned about you. I want to hear more. I'm here for you, because I think conveying that care, that's really, that non-judgmental care especially, that's the other thing, is really the opposite of the stigmatization that we were talking about.
I mean, we were talking earlier about how hard it is to be upfront about your emotions, in many places in life, but in the workplace as well. So it can feel really overwhelming. So what's the first step of advice you would say for people who really want to start talking about their emotions?
Right. Well, that's the other side of it. What's going to happen if I do open up? I mean, you don't need to have the perfect language. You don't need to have, there's no one path to communication. I think it is a risk, though, to take a risk to talk about how you're feeling. And I think you could say just that. I really want to talk about how I'm feeling, but I don't know what to say. I don't know how to do it. And also choosing carefully. We know the people who support us, to choose someone who tends to be non-judgmental and supportive. And if you don't have someone like that in your life, that is what I know we're going to talk about 988, the Suicide Crisis Helpline. Places like that, like Kids Help Phone, there are places to reach out where people do want to listen.
All right, so let's talk about anxiety. If a person is having a panic attack, what language should we use when communicating with them?
Okay, so I love these scenarios. One thing, we don't all have to be psychiatrists or therapists and have all the right language. Again, the most important thing is to say, how are you doing? Tell me more about that, and to bring that non-judgment to it. But specifically for anxiety or panic, often we can see it in people's bodies. So to just say, it looks like you're having a hard time. Could you tell me more? And to listen. Again, I keep saying the word non-judgmentally because we don't have to solve it. We don't have to give people tons of advice. We just have to be prepared to listen.
No, great advice.
I mean, I've had panic attacks at work. Like the makeup room is the famous place, and the artists, I swear, they all have PhDs in this because, and the one thing that they always say to me is, "You're safe. I'm here with you, and you're safe."
What a beautiful
Isn't that a
thing.
beautiful
I
thing?
mean, I was having a panic attack, and you know, it is like we all have heightened anxiety. So normalizing or validating, like, oh, I see how you feel, or I've been there before too, can also really help. And please don't tell anybody to calm down.
Great
no
note.
one who's ever been having a panic attack has been helped by calm down now.
Okay, that's a big one. That actually is a big one.
Yeah.
Let's talk about eating disorders for a minute, because among youths and even adults over the last few years, and certainly COVID, it seemed like exacerbated the instances of eating disorders, and they're drastically on the rise as well. When it comes to language about food, language about bodies, what do we all need to know?
Well, I heard the earlier discussion about Selena Gomez. It's a perfect example. I mean, the American Pediatric Association says, you know, do not focus on weight for young people. Do not focus on body image. So that's not a conversation that's helpful. And we also, they're unintended. Even if you say you look great, or, oh, I have people in my life who say this to me, oh, you've slimmed down a bit. And it sounds so positive, but you don't, it just lets you know that actually people are looking, they are scrutinizing you. So I think leaning into the feelings and the connection, and, you know, again, just asking, how are you doing? Or, you know, things seem a little better for you emotionally. Am I right? How are you really feeling? Much more than a focus on weight or bodies.
You know, a big one is someone in your life that may be experiencing suicidal thoughts, and language can literally save a life. So let's talk about what could be used to help somebody who is expressing suicidal ideation.
Yeah, so I'm really glad you said that. It's because that's the whole intention of 988 too, the idea that language can save a life, connection can save a life. So offering that support, but also not being afraid to ask. We used to, even in training in psychiatry, that could it make things worse if you ask someone about whether they're experiencing thoughts of death or suicidality? We know that it can't. Opening up a conversation, you know, might not be your first question, but if you are worried about someone, don't be afraid to ask them. Don't be afraid to express that or use the word suicide. There are a few things in language that have changed, though. We've come a long way. We used to say committed suicide, for example, and now that's a very legalistic term when it was illegal to try to end your life. And so we might say someone died by suicide rather than the committed suicide as one example.
Just that change of language is so important. All right, so as we mentioned before, you are the Chief Medical Officer of the new Suicide Crisis Helpline in Canada. The number again is 988. So can you talk to us about the services that this new program provides, and what do you want people to know?
Yes, so just what you said, 988, really the magic of it and what we were so excited about is it's 3 digits, it's easier to access, it's easier to remember. We hope the word gets out about it. So you can call or text that service. It's available in English and French, and you get a live responder. We have providers, we have over 40 providers across the country, or sorry, just under 40 providers in every province and territory, and those are people in their communities, over 1,000 responders who really want to listen. And my number one message would be if you're struggling with thoughts of suicide, or if you're worried about someone else, there is someone who really wants to hear your unique situation and story, and who really wants to be a trusted place for connection.
Dr. Crawford, thank you so much for this
Thank
important
you.
information today. If you or a loved one are in crisis, please call or text 988 for 24-hour support across Canada.
Hey there, what did you think? Drop your comments below and join the conversation. And don't forget to like and subscribe so you can find more on everything from food and fashion to pop culture and current events. See you soon.